John's laser surgery only took a few minutes. The healing time is 5 to 6 days, but patients will notice a difference right away.
Hi, my name is Deborah, and I'm a patient of Dr. Gilani's, and I had for 40 years a pterygium on my eye, and I had surgery at one point about 30 years ago, and it was brutal. It was very uncomfortable and pretty much a procedure where you're awake and they put a clamp on your eye and just start picking at your eye. And the healing process was incredibly painful. I learned about Dr. Gilani because the pterygium had returned probably about 3 years after I had the first surgery. And I lived with it for all those years. It was humiliating, painful, uncomfortable. I felt like I had sand in my eye all the time. People would look at me like, are you on drugs, or what's wrong with your eye, and all that kind of stuff. And it was just very embarrassing. The cold air bothered me, the sun bothered me. I couldn't drive at night because the light just reflected off my scar tissue somehow, and I was miserable. I finally went to Dr. Hauser and I said, I have to do something. I don't know where to go, and I don't want that same procedure on my eye again. It was just brutal. And so he sent me to Dr. Gilani. My first visit here was like very comfortable. It was amazing. And I learned a lot about the procedure Dr. Gilani does. I already knew the procedure that the other physicians were doing, which again was brutal. I had it done. They think they're doing their patients a favor. It's temporary. It didn't work for me. It didn't work for other people that I knew that were having the same problem, especially when you live by the ocean and the sun and sand, and you know, it just didn't work. And so I decided I was gonna go for it. I was so comfortable and so excited, and I have had my surgery now. I am 11 days out. After the first day, I just was absolutely amazed. I was amazed I had no pain, I had no discomfort. All of that violence that was going on in my eye from that pterygium, and the feeling I had, I mean, it was just all gone. It was just like, it was like, you know, somehow I was given back the eye I was born with, you know. And it brings me to tears. You know, I feel so much better about how I see, how I look, how I feel when I open and close my eyes. I just would like other physicians, other people to realize the gift that you're capable of giving if you have the credentials. If all of physicians, you know, you gotta go the extra mile for your patients. Your job is to heal, and I feel healed. I know that I'm healed. I have no question in my mind, and I'm completely healed. I'm not temporary healed, okay? I am completely visual. I have no scarring in my eye at all, and it is just absolutely, I just feel like I have the greatest gift from him. Dr. Gilani is patients that come from everywhere. I can see why. I know why. I have sent, my son has this on his eyes. My son is coming here. My brother will come here, my sister. You know, they all have them, and they've all had problems with, you know, the lack of following, you know, this incredible procedure. It's just, it's amazing. and to give that gift, you know, of comfortable sight, you know, and to give it's almost like having plastic surgery. You know, you feel so bad about the way you look. It's not a wrinkle though. You know, a wrinkle, so. It's your eyeball. And that is, you know, talk about cosmetic. You know, it was like a horror show looking at my eye. Now, as you can see, it's absolutely incredible. I thank him for the gift. I recommend to anyone who needs this kind of surgery, whoever you are. If you have a pterygium, take care of it earlier than later. Don't even hesitate to get in touch with Dr. Gilani. I'm serious. Just do it as soon as you can. If I would have known about him before, I would have been here 30 years ago. I wouldn't have had to live so uncomfortable my whole life like that. So, again, you know, Gilani Vision, he's amazing. The procedure is amazing. And he has the gift to offer to all those other ophthalmologists in the world if they want to take it. If they want to do pterygiums, they really need to do that procedure, not that other stuff. Whatever they're doing, it's not working. If they're not doing his, it's not working. You're cheating your patients, and you're cheating yourself.